Hi everyone! Today we are going to talk about some evidence-based ways that you can decrease your risk of experiencing forceps or vacuum during delivery. Forceps and vacuum can assist with something called an instrumental delivery, and that is when one of those tools are used to help the baby to come out, often to expedite delivery if the baby's heart tones are not doing well, the baby is struggling and need to be born faster, or if using forceps to adjust the baby's position if the baby is not in a position that is allowing them to move through the bony structure of the pelvis and be born. So what's important to know about these tools is that they can be overused, and there have been many reports of people while they're giving birth having the instrument be used without their consent or without their knowledge. This means that if someone is on their back with an epidural and they can't really see what's going on, a provider could potentially use forceps, for example, without that person knowing that that's what they're doing. This is obstetric abuse, and it is not an acceptable way to treat someone in labor. If you are to receive one of these interventions, it's important that you know fully what the risks and the benefits and the alternatives are to those tools. Some of the benefits with these tools is that it can help someone expedite delivery and have a vaginal birth if the baby is struggling and they need to be born quickly. So this can prevent someone from having a cesarean. But both these tools can cause injury to the baby. They can cause swelling, bleeding, and bruising on the baby's face and head, and they can also increase your risk of experiencing pelvic floor health consequences postpartum. They also both increase the risk for tears. So what are some evidence-based ways that you can decrease your risk of being offered these tools or experiencing the use of these tools? So there are 4 different pieces that I want to share with you, and the first is the choice of your provider. Your chosen provider significantly impacts your risk for tearing, your risk for cesarean, and your risk for other interventions like forceps and vacuum. Some providers truly lack the skills on the alternatives and other natural ways to support baby being born faster, or to support correcting a positioning issue, or to support correcting a fetal heart tone concern. So for example, if maybe the cord is being compressed and the baby is not getting enough oxygen, that can start to impact their heart rate. So if a midwife were to notice that, it's possible that they would first encourage you to get into a position that creates more space in your pelvis that can take that pressure off the cord to help baby be born faster, and to also help them get more oxygen and improve their ability to tolerate labor. It's possible that an obstetrician who may lack that knowledge may go straight to forceps and vacuum. Also, having a birth doula significantly decreases your risk of experiencing any interventions at all. So having a provider who you feel confident respects you, who you agree with their philosophy on birth, the way that they practice, and you feel comfortable and safe with is really important. And if you really want to decrease your risk, having a doula present who is trained can be really helpful as well. The next step is to birth in an upright position. When you're lying on your back while you're pushing, the baby can compress on a blood vessel that runs underneath your uterus called the aorta. And when the aorta is compressed, it can decrease the oxygen that's coming to you, which can then decrease the oxygen that goes to baby. So this can ultimately lead to both of you not tolerating labor well, and it can lead to decelerations of fetal heart tones. So to avoid this from happening, birthing in an upright position can support your baby in getting the oxygen and the blood flow that they need to be able to tolerate labor well. Upright positions look like squatting or standing, lunging, and hands and knees. And you can choose to add variety to these positions. So if you wanted to push while standing, maybe there's a birth ball on a bed and you're leaning over the birth ball standing up. Instead of just kind of bending your knees a little bit and pushing, for a while you could put one foot on a stool to create some asymmetry in your pelvis, and then put another foot on the stool to create asymmetry on a different side of your pelvis. So moving intuitively throughout labor and birthing in upright position supports your baby as they navigate the pelvis and helps them to have the adequate oxygen that they need to be able to tolerate labor well. And this will decrease your risk of receiving forceps or vacuum due to fetal heart tone concerns. And then tip number 3 is to choose intermittent fetal monitoring instead of continuous fetal monitoring. So if you're birthing out of hospital in a birth center or at home, you'll probably be receiving intermittent fetal monitoring with a Doppler or a fetoscope if you choose throughout labor. A Doppler is a tool that midwives use to monitor a baby's heart rate throughout throughout labor, and they do so intermittently rather than listening to baby's heart rate continuously throughout labor. In the hospital, there are a few different ways to monitor baby continuously, but rarely is this actually necessary or beneficial. So babies can be monitored continuously throughout labor, which means you're constantly listening to baby's heart rate through external monitors, which wrap around the belly, or internal monitors, which is where a device is connected to the baby's head while they're still inside, and an intrauterine pressure catheter is placed also inside of your uterus to measure the strength of contractions and the frequency. What we found based on the research that we have about continuous fetal monitoring is that it does not improve outcomes for babies and it does not improve outcomes for parents. Actually, continuous fetal monitoring increases your risk for forceps and vacuum, and it increases the risk of having a cesarean. And that is because there's something called a false positive that can happen with fetal heart tone concerns, where it may appear that the baby's heart rate is struggling, but really it is still within a variation of normal, because baby's heart rate shifts dramatically throughout labor within a certain range. So picking up every little thing can often lead providers to want to intervene, even though the variability in the heart rate that the baby is showing is actually within the range of normal. It's important to note that if you were to birth in the hospital, because so many of us rely so heavily on technology, the art and the skill of using a Doppler and listening to baby's heart tone and knowing the difference between the baby's heart tone and the placenta, which are two different things you can hear, and your heart rate as well, all of that can be picked up with a Doppler, and they all sound very different. And so providers who are trained and skilled in knowing how to listen and understand the difference between your heart rate, the placenta, and the baby, and knowing how to listen when you're in many different positions, like in the tub and hands and knees, standing, lying down, they're going to be able to give you the best support throughout labor, because it can be really disruptive, especially if you're having an unmedicated birth, to have to get into a certain position for someone to monitor the baby. So I encourage you to have conversations with your provider about their ability to offer intermittent fetal monitoring. It is something that you can absolutely choose, but I encourage you, if this is something you want, to find a provider who is comfortable with it, because when we make choices in a hospital environment with staff who are not skilled in the tool that we want to use, that can have a negative impact on our experience. So the fourth tip that I have for you today is to have your provider be hands-off when you're delivering your baby. So this means that your provider is not touching your body or your baby when your baby comes out. We have a lot of research on this throughout the world, and what we found is that the research really does lean towards provider hands-off for protecting your perineum, for decreasing the risk of perineal trauma, for decreasing the risk of pelvic floor health consequences in the future, and for decreasing your risk of forceps and vacuum. So every provider practices a little differently, but in a hands-on approach, the provider will probably be touching your perineum and your genitals as your baby's head emerges. They'll probably flex your baby's head, which means they take the back of the head and push the baby's head down as the baby exits the birth canal. And they'll use hands-on maneuvers to pull your baby to help their shoulders to clear from your pubic bone and to come out. Most of the time, this is not necessary. And with a provider who practices provider hands-off, they can assess and witness, and they can step in if necessary. Because in most circumstances, the uterus will contract and push your baby out without anyone needing to deliver your baby. No one needs to grab your baby, pull your baby, or catch your baby, as long as you're birthing in the tub or on a bed where the baby can gently glide out into a soft surface. If you were to be birthing standing up or above a surface that is not soft, then it is absolutely important that someone is there to catch your baby. And if you want your provider to be hands-off and you want to catch your own baby, but you need a little support, you could have a provider or a partner, like if you're standing, for example, be behind you and they can help catch baby and hand baby to you while you bring baby up to your chest. A lot of providers are not skilled in the art of sitting on their hands, which is a real skill. And so providers really might not know what to do for someone who is delivering their baby in an upright position and catching their own baby with the provider's hands being off. So this might feel confusing for them, and it's important that if this is something that you really want, that you firmly stand in that choice and clearly communicate that choice to your provider before you go into labor. And what I feel is most optimal is to find a provider who really aligns with your values and your preferences and already practices in the way that you want to receive care. Stretching the vagina open and guiding the baby's head out and all this stuff is really not necessary, and it does increase your risk for forceps and vacuum. Giving your provider the least amount of access to your baby and your genitals is truly the best way to decrease your risk of many interventions and to decrease your risk for tearing. So what does that actually look like? So maybe you're on a bed and you're in hands and knees, or maybe you're in like a kneeling position. And you can have your partner behind you to help you catch your baby if you want. Or you could be in the water in a reclining position, a lunging position, or a hands and knees position. And if your baby comes out, you can move your hips kind of forward and let them come out forward and catch them yourself and bring them to your chest. If you're in hands and knees, having someone behind you to catch the baby is beneficial, especially if you're in the water, because we don't want baby to come out of the water and then to go back in. And if you really trust your provider to honor your preferences, they can catch your baby without touching your body or your baby until your baby is actually coming out. And what that really looks like is keeping their hands underneath and letting the baby slide out into their hands. This is your birth and your body, and your preferences matter, and you've got this.